Our next structure is called the capitulum, which is going to be a rounded structure just lateral to the trochlea. And the capitulum is going to look almost like a knuckle or a small little marble just on the outside of the trochlea. And this is going to be where your other antebrachial bone, called the radius, is going to articulate. There are 3 fossae that we're going to learn on the humerus. Our first one's called the coronoid fossa, which is going to be found on the anterior side of the humerus. This will be just above the trochlea. This is where a structure called the coronoid process of your ulna is going to be able to slide into as you flex your forearm. Also on the anterior side, just lateral to the coronoid fossa, is the radial fossa. And this is where the radius is going to be able to travel in when you do that same movement. On the posterior side, we have something called the olecranon fossa. One thing you want to note about the olecranon fossa is that it's on the posterior side, and it's also the largest fossa on the humerus. This is where a structure called the olecranon of the ulna is going to be able to travel into as you straighten your forearm or extend it. On the humerus, there are also 2 epicondyles, a medial and a lateral epicondyle. The medial epicondyle is larger, and you can actually feel this on yourself. If you feel the big bump on the inside of your elbow, that hurts pretty good when you hit it on something. That is your medial epicondyle. On the other side is the lateral epicondyle, and this is a little bit smaller than the medial epicondyle is. We're also going to have the radial groove, which is a groove on the posterior side of the humerus, which is pretty close to where the deltoid tuberosity is going to be located. But this is where a structure called the radial nerve that we'll learn when we get to the nerves, this is going to allow it to travel around the humerus. So as we take a look, we're going to zoom in to the proximal side of the bone. So here is the head, just that rounded structure that's going to fit into the glenoid cavity or the glenoid fossa. And again, once you find the head, this tells you this is the medial side of the bone here. So here's our head. The anatomical neck is just this short region right here that's connecting the head to the rest of the bone. So we'll highlight that. So anatomical neck is just going to be that part right there. Whereas the surgical neck is going to be this portion right here, and that's going to be connecting all of these structures up here to the shaft of the humerus. So those are the 2 necks right here. We also have our 2 tubercles that we're going to see from this view right here. The greater tubercle is on the lateral side, opposite to the head, so it's the larger of the 2, whereas the lesser tubercle is going to be smaller, and it's only seen on the anterior side. So this is the lesser tubercle, just that smaller bump. And then the groove, which has got a little bit of a dotted line right there between them. But this groove that runs between the 2 tubercles is the intertubercular sulcus, or you'll also see it called the intertubercular groove. And this is where the long head of the biceps brachii tendon is going to slide right through. As we move down the bone, so here is the shaft. We also see this rough portion right here that kind of sticks outward on the lateral side. So again, still on that greater tubercle side. So here's the outside of the bone. And that is the deltoid tuberosity. So that's where the deltoid muscle is going to insert onto the humerus. Looking at the distal bone, we can see our first 2 fossa. So again, we saw the lesser tubercle earlier, so we know we're looking at the anterior side of the bone. So what we're going to see is first the coronoid fossa, which is going to be more medial right there. And then just lateral to it is where we'll see the radial fossa. So it's a little bit smaller right there. We also see our 2 epicondyles. So the medial epicondyle, the same side as the head right here, is the bigger one. So there's medial epicondyle. The smaller one on the other side is the lateral epicondyle.